Welcome to the Winton Woods Warrior Supercast, where we highlight what's going on in the Winton Woods School District and the superstars that you have in the district. You have so much going on all the time, lots of topics. But today we're going to take just a few minutes to focus on one. We want to talk about the health center and the community plans that you have. There's some information that's out, there's some misinformation that's out. So we want to go right to the source. And thank you, Mr. Smith, for coming in.
All right, thank you, Dana. I appreciate you. One of the things that we really want to let the community know, community is really concerned about taxes, like everywhere, everyone, right? And we want to let the community know that the site-based health center, the community learning center, better known as the community learning center, it has two distinct names depending on how you feel, is actually a funding project that's funded by the Healthcare Connection. It is not funded by Winton Woods City Schools. There are no tax dollars that come from the residents of the community to fund the project. And it will have dental, it will have vision, it will have eyewear, it will have screening for hearing, all the things that kids need, but it is also open to the community. So there are times where the community want to have a conversation. Well, how do I fit? How do I fit into your scheme of things? Mm-hmm. One of the things that we'd like to say at Winton Woods City Schools is that we're a city school, we're a community school. And it's all about how the community can be engaged. We want you to visit the schools, we want you to be part of it, but things can't go without taxes. Taxes are part of who we are and what we do. We've not had new revenue since 2009. And we keep waiting on the governor's report. We're hoping that the governor will come through with additional funding, but we must take care of ourselves. And you can't wait for government to come and bail you out of situations. I don't know a district that has not had new funding since 2009. If you are out there and you've been able to do it, please call me, let me know, because we want to know how to strategize and make it work. People have asked me questions about, what are you going to cut, Superintendent? Cutting really challenges morale. And we have more students coming. So imagine if we cut staff, but we have more students coming, that becomes a bigger burden on the staff. And then you have staff turnover. Sure. So we're really working diligently not to let that happen. But back to the original with the Healthcare Connection, it is a project that is privately funded for the benefit of this community.
That is a really important thing to know, because I think obviously that's the first question when you see a new program.
Yes.
But there's reasons that you're looking into this need. You have looked at at your students, at their families, and sometimes the way you help them be successful students isn't academically related.
Oh, absolutely.
And this to me looks like one of those situations.
Well, it's actually, it's family friendly, where parents don't really have to take off work to get their child seen by a real physician. It's staffed by physicians, it's staffed by a staff nurse. There's a dental opportunity, there are dental chairs, and there are many times where young people are not feeling their greatest. Mm-hmm. And sometimes we don't have enough information about it. So having them go right into the health clinic, right into the health center, and right back to class is actually something that we've been working on this project for about 3.5 years. And so now it's come to terms.
So you're starting to see a little bit more of the need and the details.
Oh, absolutely, absolutely.
The fact that it would enhance the community that you serve, but also I can't imagine how helpful that will be for students to know that, yes, I feel terrible, I can't focus on my learning, but there's nothing I can do about it. And my mom can't take me to anyone today, and I'm just sitting here in class. Yeah, I wouldn't learn anything all day.
Right.
I'm just trying to not fall asleep on my desk that day.
But it becomes a very miserable situation because remember, here is the other piece. We're a project-based learning district, so there's always interaction and always activities. It's not a teacher standing up lecturing where the kid could just kind of zone out. He may have to participate in his group, and he may not be able to do it that day. So if we have that clinic right there close by, we can get the kid the attention that he needs so he comes back the next day vibrant and excited about education and not feeling like I'm overwhelmed.
So I love the need for it. I love the connection and as it being another way to help students become successful. Talk about this partnership that helps with the funding for it.
Well, the Healthcare Connection has been around for a while, and we were able to do some observations of some things that are happening at Mount Healthy and something that was happening at Princeton. And my question to Dr. Joseph is, why not us? And we already had the layout. That's usually the hardest part, to find the building and the layout. But we actually strategically put this in our architectural design to know that one day we would have this dream come true. So we're planning on opening the Healthcare Connection / site-based health clinic / community learning center in early August.
Oh, I can't wait as Waycross to be there and record that and tour the inside and see what that looks like. But that partnership to me is what makes it so exciting. It means that you made the space, hoping that you could get that together, and then you made the connections to get someone to bring it in.
But I think the main part is this is not a burden on taxpayers.
Yeah, that's huge.
This is not a burden on taxpayers, and I can't say that enough, where people understand that we've been going out of our way to find other resources so everything is not impacted on the homeowner. This is something that the homeowner can actually benefit from and be part of. We know COVID's been around. COVID's not going anywhere. Our children are also dealing with certain issues of being diabetic. I mean, some of these other factors, early warning signs and early detection gives us a better chance of keeping kids healthy.
And healthy kids can learn better, and healthy kids are going to enjoy being a student better.
Healthy kids are more productive.
Yeah.
As well as healthy adults.
Absolutely. And just part of the community. Like you said, there aren't a lot of resources in some of the corners to some of the residents. So I love that you've thought about that aspect of learning and the community and being part of the community, but also that you've looked for other ways to fund it. You're right. You can't avoid needing taxes to fund some parts of the operations of the schools.
Absolutely.
The fact that you look beyond those operations, but then also look beyond the taxes to ways to fund them is exciting. I feel like that is something that residents can appreciate being part of the district.
And when this health center opens, we want it to be a grand opening where everyone gets a chance to come in, see how it's run, see how it's facilitated, and also to see how it maximizes learning for young people.
Yes, absolutely. Well, is there anything else you want to tell me about these plans, about the center, or just any other questions you've been hearing from your families in the district?
Well, we've been hearing from families in the district where we're going to get them to the doctor, or the appointment is scheduled here, or we can't get them in, or it's a virtual appointment. And I think that slows the families down. They want to know, how is my child how is he doing health-wise? Because we talk about education being our primary focus, but an unhealthy kid, you can't focus on education because it's sort of like a hungry kid. You can't focus on education if I'm not nutritionally fed, if I don't have the right nutritional value. So all these things go together. We talk about so many pieces about, we have 111 different opportunities in our district to keep our kids engaged. So if they're healthy and they feel good about school, they will come. Our enrollment continues to increase. And so again, I concern myself when people talk about riffing, which is a reduction in force, having more kids and less staff. It doesn't fit. That means you have a staff that's going to burn out.
And it's the first thing I think a parent asks is, what's your ratio?
Absolutely. And parents should be asking that.
Yeah.
They should be asking that. So I appreciate your time. I appreciate the energy. I appreciate Waycross and making sure that people hear our voice and understand our need. We love children, but we want to make sure that children are taken care of the right way.
Absolutely. I appreciate your time coming in. I look forward to getting more chances that, if you have a question and you feel like, gee, I wish there was something I could watch that would clearly explain the answer to that question, let us know, because we can do this again. And I think when we do this quickly and just let folks have something that they can share, they can watch, they can get their questions answered,
Absolutely.
I think it helps everyone. So thank you.
And again, no cost to taxpayers, the site-based health clinic.
Yeah, before we end, let's just wrap with what we have. What have we learned here today? We have learned there why it's so important to be looking at all these aspects of supporting kids, including their health and the community, but that also that this can be done without tax support, which is fantastic.
Yes, absolutely.
Thank you so much.
Thank you.
And thank you for watching. That means you want to stay informed in what's happening with the Winton Woods District. See you next time. Whoa!